Revised report on the intersection of state single-payer healthcare systems, workers' compensation, and specific challenges in Washington state. Introduction. The debate over implementing state single-payer healthcare systems in the U.S. necessitates a nuanced understanding of its potential impacts on existing workers' compensation systems. In states like Washington, which operate without a state income tax due to constitutional constraints, the financial underpinnings of such a healthcare reform present unique challenges. Moreover, concerns about the existing framework for medical accountability, particularly in workers' compensation, SSDI, and VA systems, underscore the complexity of healthcare reform. This report addresses these issues, highlighting the need for comprehensive dialogue that includes workers' compensation reforms and considerations specific to states like Washington. The laborer's grand bargain and workers' compensation systems represent a critical safeguard for labor, ensuring that workers have access to medical care, rehabilitation, and compensation for work-related injuries. This system is foundational to the laborer's grand bargain, which balances worker safety and employer liability. Any healthcare reform, including single-payer models, must consider the preservation of these protections. Single-payer systems and constitutional considerations in Washington state. Washington state's consideration of a single-payer system faces unique hurdles due to its constitutional prohibition against state income taxes. Implementing a single-payer system, typically funded through taxation, would likely necessitate a constitutional amendment, a process requiring broad public support and legislative approval. The prospect of altering the state constitution raises significant political and practical challenges, suggesting that healthcare reform efforts in Washington must navigate complex fiscal realities. Medical accountability and the protection of workers. Critics of the current healthcare system, including those concerned with workers' compensation, SSDI, and VA systems, point to a lack of effective oversight and accountability among medical providers. The perception that medical boards, composed of physicians, fail to adequately police their own, contributes to a lack of trust in the system. Instances where doctors accused of misconduct continue to practice raise questions about the effectiveness of current regulatory mechanisms in protecting patients, especially those navigating workers' compensation and disability systems. Impact of single-payer on workers' compensation, a closer look. Integration with existing systems. The integration of a single-payer healthcare model with Washington's workers' compensation system requires careful planning to ensure that worker protections are not compromised. This includes maintaining robust mechanisms for addressing workplace injuries, disease prevention, and employer incentives for safety. Fiscal and constitutional challenges. The absence of a state income tax in Washington complicates funding for a single-payer system. Any proposed model must consider alternative funding mechanisms that comply with the state's constitutional framework, ensuring sustainable healthcare financing without undermining public support for constitutional amendments. Accountability and oversight. Enhancing accountability within the healthcare system, particularly for those serving injured workers, is paramount. Reform efforts should focus on establishing rigorous oversight mechanisms to ensure that medical professionals meet the highest standards of care, especially within workers' compensation, SSDI, and VA systems. Conclusion. As discussions about single-payer healthcare systems progress, it is imperative to include workers' compensation in the dialogue, ensuring that labor protections are preserved and enhanced. For states like Washington, specific challenges related to funding mechanisms and constitutional limitations must be addressed. Moreover, reforming oversight and accountability practices within the medical community is crucial to restoring trust among those reliant on workers' compensation and disability benefits. Comprehensive healthcare reform that considers these factors is essential for protecting labor interests and advancing the well-being of all workers.